All right. Thank you so much for your patience today, and thank you for joining us. My name is Lori Marie Pashota, and I'm the Education and Outreach Coordinator at NeedyMeds. NeedyMeds is a national nonprofit organization. We are an informational resource. We have a toll-free helpline and also a website that will connect patients and their healthcare providers and advocates with programs all over the country that will help you pay for your healthcare costs, and that includes prescription medications. So thank you for joining us today. Today we have a special topic for our webinar. The title of our presentation is Be an Engaged Healthcare Consumer, Protect, Detect, and Report Healthcare Errors, Fraud, and Abuse. And we're joined by Lucilia Prates-Ramos today. But before we begin, I just want to take care of a few housekeeping points. Everyone will remain on mute, which means you'll be on listen-only mode. But should you have a question at any time, you can simply type it into the questions panel in your control box there, and Lucilia will address your questions at the end of her presentation. This webinar will be recorded and placed on our webinar library page and also our YouTube channel, usually within a week of the date it airs. And at the end of this presentation, I will provide my email address should you have any further questions or should you like a copy of Lucilia's slides and any other handouts she may have. So without further ado, let me introduce our guest. Today we're joined by Lucilia Prates-Ramos. She's been the statewide director of the Massachusetts Senior Medicare Patrol Program for over a decade. And the Senior Medicare Patrol programs are across the country. It's a statewide partnership, and they engage and educate hard-to-reach vulnerable populations on the importance of taking an active role in their health care. It's very important work, and Lucilia has extensive experience and knowledge of the intricacies of the healthcare system and all of its many complexities. Lucilia has also served on the board of Healthcare for All, which is Massachusetts' leading consumer health advocacy organization. She received a gubernatorial appointment to the Massachusetts Department of Public Health Council in 2007, and she currently serves on the Massachusetts Health Quality Partners Consumer Health Council. And while she's from the state of Massachusetts representing her state program, much of what she's going to talk about is applicable across the board nationally, and she'll explain that as well. So without further ado, I'm going to turn over my presentation to Lucilia. I'm making you the presenter now. And please share your screen when you're ready.
Okay, I think I've shared my screen. So thank you, Lori, for that introduction. Hello, everybody. Can you see my screen?
Not yet. It might take a couple of seconds, though. So I think it's doing something. Can't see your screen yet. Let me... Did you share your screen? Can you try that again?
Yeah. Oh, I'm so sorry.
That's okay. Let me try this again for you.
Technologically challenged at times. Here is an example of Murphy's Law. What can go wrong will go wrong. I didn't do anything differently than. Click to stop screen sharing.
There we go.
Okay, great. Thank
Excellent.
you.
You're welcome.
I must have touched the wrong button. I am technically challenged, I admit. So hello, everybody. My name is Lucille Ramos, and as Laurie said, I'm the statewide director for the Massachusetts Senior Medicare Patrol Program. And okay, so the Senior Medicare Patrol Program is a federal program. There's one in each state. And there are 54 programs. There's also one in the U.S. territories of Guam, Puerto Rico, U.S. Virgin Islands, and Washington, D.C. And our mission is essentially the same. It's to reach and educate Medicare and Medicaid beneficiaries, their family members, caregivers, professionals, and anyone who would like to listen to our message, I say, because it is so important to be or to become an engaged healthcare consumer. The Massachusetts Senior Medicare Patrol Program, as Laurie pointed out, reaches limited English proficient. We have a particular focus on reaching limited English proficient populations. We currently can serve 11 different language groups, including Native Americans and rural elder communities across the Commonwealth. And we are, there are days we're on the Cape and we're on the islands, Martha's Vineyard and Nantucket. And then, the next day we may be as far west as Pittsfield and Lenox, Mass. So, and that's true for all of the SMP programs across the country. We are statewide programs. The Massachusetts Senior Medicare Patrol Program operates with the advice of a statewide advisory council that's made up of the organizations that are listed on this slide. We also have put together regional advisory councils that are essentially made up of consumers and representatives from elder-serving organizations. They are dormant from time to time because of our funding challenges. So we tend to, when we receive our funding, we tend to reactivate them, and they're working on their own out there. But we'd love to utilize the regional advisory councils a lot more, but unfortunately that's not possible all the time. Again, because of the funding constraints. So we work in partnership. Our motto is to work in partnership with AAAs, and that's not the AAA that we call when our car breaks down. That's the Area Agency on Aging and the Aging Service Access Points of the ASAP, the Councils on Aging, aging service providers from across the spectrum of care, and as well as mainstream entities such as the Executive Office of Elder Affairs, Consumer Affairs, the Attorney General's Office, and triads. I don't know how many of you know of triads. The triads are essentially, it's a triangle, and at each angle there's a group that represents that angle, and that is, at one angle we have elders, at the other angle we have community-based organizations and mainstream organizations that work with elders, such as the AAAs, the ASAPs, the COAs, and senior centers, et cetera. And then at the other angle, we have law enforcement. And there's no hierarchy. It's just at the angles. And they come together, this group, to work at identifying what are the scams that are going on and how can elders be better protected. And so they get the input. They work very collaboratively with the elders. So they, in fact, have thought of the file of life. I don't know how many of you are familiar with the file of life, but it's essentially a magnet, and it has a little pocket, and people put it on their refrigerator so that if they ever call the ambulance, that the paramedics know to look for that, or the yellow dot, other, on their cars. To know to look in the glove compartment. So that's come out of the triad work across the country, and there are triads all over. We also work with community-based organizations and faith-based organizations and other grassroots organizations, anyone who invites us to come out and do a presentation and educate a group of consumers about the importance of preventing healthcare errors, fraud, and abuse, and the importance of being engaged and being very present for the health encounter. To prepare for that health encounter. Think about what do I want to speak to my doctor about. I know from personal experience, if something hurts, by the time I get to the doctor, I've forgotten about that pain and I want in and out. That happens to a lot of people. It's not just me. So we need to be a little bit more cognizant of that. So the SMP program essentially works in partnership, to promote a better understanding of how to detect and protect against these healthcare errors, fraud, and abuse, which cost billions of dollars, but can also inflict real harm to beneficiaries and or their family members. And we'll get into that a little later. So, and how do we do this? Well, we do this by doing a lot of working in partnership and continually fostering partnerships with our groups and making referrals, cross-referrals, to and from mainstream entities. So if somebody goes to an aging service access point or the AAA or the Council on Aging and they present themselves with a concern about a particular issue or bill or health quality issue, et cetera, that they know where to go, that the people at that center know who to refer these individuals to. So that's how we do a lot of our work. If we get calls, like for example, I just got a call today from someone who was calling about a hospital bill, which I may have an opportunity to share with you a little later if we have the time. But this person was calling me from Florida, and they happened to call Medicare, and Medicare gave them our number. And I couldn't understand why, but maybe they were just looking at the wrong line or wherever they were reading. And I said to her, you need to call the SMP in Florida, and gave her the phone number and who to call, and reassured her that if I'm sure that the person in Florida, the lead person for SMP and her team will help her out. But I told her if she encountered any problem to feel free to call us back, and we would, I would make sure to point her in the right direction once again, or call the director there and facilitate things for her. So we work very closely with the SHINE program in Massachusetts that's serving health information needs of elders. For those of you who are outside of Massachusetts, that's the SHIP program, the state health insurance program. And we work with the QIO. The QIO is the Quality Improvement Organization, and recently in Massachusetts, that's MassPro. And now for most of the country, it's Levanta or Health-Centric Advisors. So I don't know where you're all located, but the QIO, the Quality Improvement Organizations, have undergone some changes, and I will gladly also share some of that information with you, Laurie, and you can send it to people if you'd like. So we work very closely with the Attorney General's office around Medicaid, Medicaid errors, fraud, and abuse, the Office of the Inspector General, and the Centers for Medicare and Medicaid Services. And essentially what happens is when people call us with a complaint, like this lady who called me from Florida today, assuming she was from Massachusetts, and I took that complaint, we would enter it into a national database, which we call SmartFacts, and we entered the information into that database. We get a release of information from that individual, and the individual then sends us what their complaints are, the forms related to that. So that would be the Medicare summary notice, or explanation of benefits, or any bills from the institution they're being billed. And then we look at that, and we follow the program, the SmartFacts program, and entering all the data that is necessary. We upload these forms. And then I would refer her complaint, her specific complaint, would be referred to the Centers for Medicare and Medicaid Services contractor, who would then investigate that complaint. And it sounded like she was being clearly being sent some abusive billing from, from my perspective, from where I'm sitting, and the story that she told me. So, according to the federal government, there are billions of dollars lost each year due to waste, fraud, and abuse. Does anybody have any clue? So just think to yourself, how many billions? And write that number down. I'm going to tell you that number. That number is anywhere between, we use 60 to 90, and that's a very conservative number. I recently attended a conference in Washington, D.C., where Dr. Agrawal, who is the lead person, the director of the Centers for Program Integrity at the Centers for Medicare and Medicaid Services, really validated my presentation. And he said, that I do day in and day out. He said, so much of this is related to quality, and if we lump together waste, fraud, abuse, errors, and we look at these numbers, it's hard to really give it a number. You know how numbers are. It depends on who's massaging them and what spin we're putting on them. But the number can range anywhere from 60 to 200 and some odd billion annually of American tax dollars. And so, and healthcare fraud runs the gamut of, street crime to white-collar crime. So what is fraud? It's an intentional, and, one is very intense on defrauding. So it's intentional and knowingly and willfully one lies in order to get reimbursed or paid for services that were never provided. Fraud is intentional deception and misrepresentation. I don't know how many of you saw a 60-minute special that aired a few years back. I'm going to guess 3 years because I know time flies so rapidly. And it was a 60-minute special that aired, and it talked about fraud in Florida, which is the capital for fraud in the country. And it talked about how it is much easier for drug pushers to push the button on a computer and defraud our federal government, Medicare namely, than to push drugs. It's much more profitable. So what are errors in abuse? How do they play themselves out? So healthcare errors and abuse are typically those unintentional incidents and practices or procedures on the part of providers that are not consistent with appropriate medical, business, or fiscal practices. They're just not sound practices. Like the example I told you earlier about this woman who was calling me from Florida. I will quickly tell you. She was calling me because she was admitted to a hospital in Florida, and she was there for a physical ailment. And they sent her a psychiatrist, and now she alleges she does not need a psychiatrist. She did not want the psychiatrist, and she told the psychiatrist to please leave and not come back and see her. And the psychiatrist has billed Medicare for 3 visits. And the first visit that she was there, she said to me, she was literally in the room for 2 minutes. So that needs to be investigated by, the CMS contractor. So that's where abuse, it might play itself out to be abusive. It might be fraudulent. It's up to the Centers for Medicare and Medicaid Services contractor to determine that. So such procedures may result in receiving payment for services that fail to meet these professionally recognized standards, obviously. The standards of care, or are not medically necessary, and therefore incur these costs that equate to the 60 to 200 and some odd billion dollars of wasted dollars within our healthcare system. So I'm going to give you some examples. I also like to say that our healthcare system we're able to get such good healthcare in the United States that we have some very antiquated infrastructures at times. It's getting better, I think, I hope. So examples of errors, fraud, and abuse. I'm going to share a personal one with you. back in 2008, March 7th to be exact, I took a fall and broke my arm, and I ended up, I also suffered a concussion, and then I ended up going to the hospital later that night. And I got excellent care at this institution that I went to. But in the midst of it all, I was going to do some traveling the following week, and this was over the weekend, and I bargained with the doctor that persuaded him that I really wanted to go home in a sling, because I was thinking, I'm going to go to D.C., how am I going to shower and take care of myself? I really did not want to be in a cast. So he said to me, you know what, I think you probably could get away with your sling. I had broken my elbow. And he said, there's a couple of schools of thought, and, maybe you can get away with the sling. So I left. I went in about 9:30 at night, and I left the following day at 5:30, 6 o'clock in the morning. And so I was in the emergency room all night, and I got excellent care, I have to say that. And I went home, and then around noon I got a phone call from the hospital and to tell me that the orthopedist that was on duty that shift, who had relieved the other person, thought really I needed a cast, and they wanted me to come back in. So I went back into the hospital, and I got there, and I said to them, I said to the emergency room clerk, I said, you know what, I just left here, so I don't want to get billed for another emergency room copay. And she said to me, well, you have to sign here. And I wasn't about to argue with her, but on the back of the sheet, I made it very clear that I had just left, at 5 in the morning, and that I did not want to receive a bill for a copay, and that I refused to pay. I made that very clear on my form. So lo and behold, a few weeks later, I get a bill for the March 7th emergency room visit, and I paid my $50 copay. And then the following month, let's say, a few weeks later, I got another bill for the copay for March 8th. And it was a Friday night, I'll never forget, because I couldn't take any action immediately, and I had to wait for the Monday. And as I looked closer at my bill more closely, I realized that they had also billed my insurance company for the prepping of my arm for a cast, which I did not get. Oh, and by the way, on the 8th, when I went back in and spoke to the doctor again myself, I said to him, I really opted for the sling because I'm going away. Do I really need this cast? And so this second person involved said, no, you really don't. I said, so what was my visit here all about? But I was very grateful I didn't need the cast, and then went home and then started getting the bills. And when I called, they told me I had to call the insurance company, so I felt like I was being given the runaround. And I do this for a living. And so I called my insurance company, and when I spoke to the frontline person on the other end of the phone, she said to me, well, we've already paid the insurance company, so we can't retract the payment. I said, you got to be kidding me. I said, can I speak to your supervisor? So once I got the supervisor on the phone, and then I had a conference call with the hospital billing department, and I said, this is what I do for a living, and this is a real waste of time, and I'm somebody who is probably pretty well versed in this and can argue my way out of these situations, but if this was an elder or somebody with limited English proficiency, it would be very difficult for them. And so we just need to clean up our act. So they dropped the charges, essentially. They told me that they were waiving. And I said, no, you're not waiving. You're not supposed to be billing me. So this is my long story, my long-winded story. Sorry to bore you. So I may come back to doing a little bit of an overview on medication and lab tests, but what we see play itself out in lab tests is unbundling of tests. So if somebody goes in and they recommend a cardiac panel, then they break out all of the tests and bill for them independently. It's all the tests within the cardiac panel, for example, but they're billing for all the tests independently. And that can really accrue a greater number of dollars. So we see a lot of this in durable medical equipment, and this lady, you will get this article among the materials that you'll be getting from Lori, is Rita Vines. Rita lives in the service area of the ASAP where the Massachusetts Senior Medicare Patrol Program is located. And Rita lives in elderly housing, and she has a neighbor who is in her late 90s, and her neighbor received a flyer from a durable medical equipment company out of state that really persuaded this lady to look into getting an electrical scooter, you know, the Cadillac model of scooters. And her children said, Mom, you really shouldn't get this. This is dangerous. It goes too fast. We think you're going to hurt yourself. And they persuaded the mom not to get it, not to follow up on this flyer that she had received. So she shared the flyer with Rita. Rita, whose chair was really getting too old, and the battery wasn't working, and it was taped, duct tape, as you can see the red duct tape on the chair. Rita called the company, and they were only too happy to deliver her the electrical wheelchair that was not the Cadillac that she was expecting. And in fact, it was they never weighed Rita, they never measured Rita. In fact, the chair was very cumbersome to move around, for her to navigate around her apartment. And Rita called the company on numerous occasions to see if they would please come and repair the chair, give her a new chair, take the chair away, anything. But it was not working for her. It was sitting in the corner of her room. And they just told her, you know, we're not going to do that. You know, the chair's yours. You know, you own it. And they had their money. So when we got a hold of this story, her resident service coordinator called the SMP program. I actually intervened and called the durable medical equipment company myself, and they were not very nice. And that's really an indication to me that something's off, always. And so I put it into SmartFacts. I referred it to the Centers for Medicare and Medicaid Services contractor. And lo and behold, about a year later, several months later, close to a year, if not a little longer, Rita, the durable medical equipment company, was ordered to go and pick up the chair and to reimburse Medicare to the tune of, I think, $3,900 and some odd dollars. So Rita then was able to go and get a new battery for her old chair, and she's stuck with her old chair unless she's bought one since we last had any contact with Rita. So we see this play itself out with durable medical equipment companies. Now, I say that to you, and I also say I'm not here to demonize anybody or any company, because everybody is trying to do good by their consumers and clients. I always approach any complaint that way. But I think we need to also be very aware that these things are going on, and that we all need to have a role in detecting this and protecting ourselves and our loved ones and reporting it, because our healthcare costs are what they are today, and our medication costs are what they are today because of abuses such as this. So we also see this play itself out in home health. And so home health fraud looks like this, okay? Performing skilled nursing and home health aid services in a single visit, falsely documenting the records to reflect more than one, and billing for more than one visit. You know, billing for skilled nursing or therapy services when really housekeeping or other home chore custodial services were in fact provided. Billing for services provided to beneficiaries who don't meet the homebound definition. And that homebound definition changes from time to time. So I can see where that might be, you know, an error. But if it's not corrected, it's certainly abusive, and it can play itself out to be fraud. If, you know, services are being provided to somebody who, you know, who can go out to a restaurant and to church and to doctor's visits. Billing for skilled and unskilled nursing care that was provided by a home health care worker, and, this happens. So we encourage all beneficiaries, young, old, children, to keep a medical journal. I was actually at a health fair this weekend at the University of Massachusetts, and people were very interested in our healthcare journal. It's our, I call it our toolbox, the healthcare journal, a pen, a magnifier for our elders, and also a brochure about fraud. I think by getting that to people, we're equipping them with information and a place that they can write things down, numbers that they can call. And, there were a lot of young kids there with their parents and grandparents at this, it was a money conference actually put on by the Department of Treasury. And I encouraged them, why don't you buy your children a journal of their choice, a notebook in the store, and get them to start writing down their doctor's visits and maybe their fears or questions they might have for their doctor, to try to to build a culture where consumers are absolutely engaged. So some important recommendations we make to people is to keep an updated list of their meds in these journals, to prepare for medical appointments. There's a section in the journal that asks some probing questions and has an area where people can write down their questions and then look for an answer. There's a section for that answer. And to carry these journals when they're traveling. Now, why the updated list of meds? Because we now are given these lists of meds when we go to the doctor. We have healthcare encounters with our providers. But if we're getting our healthcare in various places, that list might not be totally updated. It's really important to be very transparent with our physicians and our healthcare providers about what medications we're on, because I say to people all the time, 5 prescribed medications is a recipe for a fall, and one fall can end it all. And we need to be very transparent and have our providers do some medication reconciliation. Look at the meds and see, are there any medications here that have can counteract with one another? What's the impact? What's the impact on my health? Is it going to make me dizzy? What are the side effects? So just to be very proactive about that, and to always compare the SMP Personal Healthcare Journal entries to one's Medicare summary notices and the bills and the explanation of benefits. And by the way, for people who have insurance companies that send out explanation of benefits, or don't send out explanation of benefits, they're supposed to, by law, do that. And I'll get into that in a few minutes. So I just wanted to give you the ABCDs of Medicare. And so we work during our working career, we pay into Medicare A. So people think that's free. I'm entitled to Medicare A when I turn 65. So, or I become disabled. And if one becomes disabled after being disabled for 24 months, they're eligible to get Medicare A, unless we're talking about end-stage renal disease or Lou Gehrig's disease, and then that people who have those diseases can receive Medicare earlier. So Medicare A works with Medicare B, and Medicare C, which you see that I've removed it a little bit. I couldn't quite manipulate this because of my technological challenges. But Medicare C looks a little different, pulled out to the right, and it's in a different font. And Medicare C is really is a different little animal. So, and I'll get to that in a minute. And then we have Medicare D, and that's really the only letter that makes sense. in the Medicare world, because Medicare D is for drugs. So I'm going to go to the next slide and give you just a quick overview of what's paid for. Under Medicare A, we get inpatient services paid for, admissions to the hospital, home health care, hospice, and skilled nursing facility. And that's paid under A, which works with B. And so B is for outpatient, okay? Outpatient and consults while one is inpatient. So this lady I talked to you about who was in that Florida hospital, if she was seen by somebody, that gets billed to B. If she was seen by if she had a psychiatric consultation, that is billed to B, the outpatient, because it was a consultation while she was an inpatient. And that works together with a Medigap supplemental plan. And that, so Medicare A and B only pay 80% because Medicare was never intended to be pay 100% of one's health care. And it works with the Medigap plan. And the Medigap plan is what pays the 20%. So that if you get A, B, and a Medigap supplement, you get 100% of your health care paid for. And you need to buy a Part D, because if you don't have a Part D upon eligibility, you will be penalized when you go and purchase the Part D. Medicare Part C is a Medicare Advantage plan. It's HMOs, you know, the health maintenance organizations, and the PPOs, which stands for Preferred Provider Organizations, and the PFFS, which is Private Fee for Service plans. And they are the Medicare Advantage plans. They make up the Medicare Advantage plans. So if you have Medicare C, typically your Part D, your prescription coverage, is part of the C plan as well. Not always, but oftentimes, more often than not. And you would not be using your Medicare card, original Medicare Part A, B, and the Medigap, because C would take care of everything. Now that works for some people, and that's why we're upon open enrollment. In fact, it started today. So for all elders, we say to them, you know, anybody who's a I shouldn't say elders, anyone who is a Medicare beneficiary really should go and see a SHIP counselor and figure out if they're enrolled in the correct plan for them. I like to point out to people often that what my husband has for a health plan isn't necessarily the appropriate plan for me. So it's very important to really understand, you know, what are my medication needs and what are my health care needs. And that gets put into a computer, and the computer essentially will show 3 different plans for that individual and that particular geographical area where they reside in accordance to the zip code and what insurance plans they should be considering to enroll in. And so, again, I highly recommend that people do that or encourage their loved ones and neighbors to do that. So some important reminders. Carry cards only when you need them. You do not need to carry your Medicare card with you, your Social Security card with you, all of these credit cards with us. Contrary to what the commercials tell us, never leave home without your American Express. So carry cards only when you need them, when you're going to the doctor, when you're visiting the hospital for health care purposes, or a clinic, or you're going to the pharmacy. Your Medicare card, protect it like it's your credit card. Your Medicaid in Massachusetts, Massachusetts is called Mass Health, and other places it's called other things, and other insurance cards, protect them. Social Security card numbers, you know, our Medicare card is often our Social Security card or our spouse's. That's the number that's used on Medicare cards. And protect it like you would protect a credit card. And people sometimes will say to me, well, you know, what if I fall? What if I get into a car accident? Well, we have a Hill-Burton Act that protects us. When you get to the hospital, they have to treat you, and you can follow up with those numbers. Now, one more reason why it's so important to be really engaged in our health care and the health care of our loved ones, in particular elders, very important, is, there are conditions that we acquire in hospitals, such as hospital-acquired infections, foreign objects being left in people, air embolism, transfusion of the wrong type of blood type, severe pressure ulcers, fractures because we took a fall. We go in for a pneumonia, but we took a fall, and that shouldn't be happening to us. Joint dislocation, head injury, crush injury, burns, electrical shocks, all these things can happen in hospitals. And in 2008, Medicare, in an effort to promote quality, stopped paying for 9 different conditions. So if I go into the hospital, I'll give you a quick example. If I go into a hospital with a pneumonia and I take a fall and I break my hip, all my care related to that broken hip, or I acquire a hospital-acquired infection, my care related to that, Medicare will not reimburse at the same level or reimburse at all, okay? Surgery on wrong parts of the body, we hear about this. Surgery on wrong patient, wrong surgery on a patient. So we need to be very vigilant, very, very present for our healthcare encounter, to write it down. I'm coming in, the doctor said this to me. This is what I have. Can you spell it for me? Because I don't know how to spell it. Don't feel silly. Don't feel ashamed. Get that information down. Write it all down. Because people forget things. We forget things. I forget things from one minute to the next. So this is really important. So I'm going to share Antonio's story, but I ran into a little bit of feedback yesterday, noise. So I'm going to skip through Antonio's story, and I will end with Antonio's story in case we have that feedback, so it doesn't break the continuity of our presentation. Okay, some more important reminders for beneficiaries. Make sure the prescription you're getting is paid for by your prescription meds are paid for by your Part D insurance. This is a good time for this webinar. There couldn't be a better day. This is open enrollment today. And if it's not covered by the insurance, consumers should explore the following. Ask questions. Just ask. Ask the pharmacist, and they don't tell you everything. I'll tell you a quick story. My mother's on last call. Her insurance company is not paying for the last call all of a sudden. And I called, so she gets her meds at Walgreens, and Walgreens never told me that they have a coupon that I can get that is the last call becomes half price. So we just need to be really vigilant and really knowing, and you guys are in the know if you're connected to NeedyMeds, but it's just people are not forthcoming with some of this information, so we need to keep asking. Exception forms. So there's an exception form, and many of you may be aware of this, but if a medication is not covered or included in your plan's formulary, your doctor can request an exception form and fill out the form and send it back to the insurance company, and oftentimes, more often than not, the insurance company will provide the exception and the person can get their medication. We worked with a client a couple of years ago who was on a patch that cost $500 a month. And through this exception form, he was able to get it. So we saved him $6,000 a year. So there's also a low income, and this isn't based on income or anything, the exception form. So there's a low income subsidy also, and that is all dependent on, there's a criteria to be met for eligibility there. And there's various low-income subsidy programs. If you go on you just Google low-income subsidy, Medicare, Medicaid, there's various programs that come up. Prescription Advantage, State Prescription Assistance Program, SPAP, is, most states have this, or some states have this. I would encourage people to look into it. In Massachusetts, it's called Prescription Advantage. And for those of you in Massachusetts, the number here is the number for the Executive Office of Elder Affairs. And once you dial this number, it will prompt you on how to get to Prescription Advantage. So also in Massachusetts, we have the Mass College of Pharmacy and Health Services. They have a pharmacy outreach program, and this is their number. And they do a lot of, there's a similarity to NeedyMeds, but they also do a lot of medication reconciliation. So if you're on 5 or more prescribed medications, or you know someone who is, or you want some particular information on a particular med, they can provide you with that. They're a great resource. And then there's the greatest of the great resources, NeedyMeds, connects consumers to programs that assist with paying of healthcare costs and including medications. And you all, I'm sure, are very much more familiar with NeedyMeds than I am. So I just have some reminders, really important. I like to point out to people all the time, always check for restrictions on your Part D plans. Always make sure that the medication belongs to you or to the patient you're picking it up for. Always count your pills in the bottle, etc. If the pill looks different, if the color has changed, if the shape of the pill is different, inquire about it. Maybe they changed, I'm lost for words. Maybe they have changed their supplier, but that's an important piece of information that you really should always be very present. Take your meds home, count the pills, because if you need the pills down the road, let's say after the middle of the month, you're going to have to pay for them because your Part D is not going to pay, and there might be a processing fee that the drugstore can put on that. And in addition to that, it could cause it could wreak some havoc within a family, if mom's confused or dad's confused, and where's the pills? Did you take too many? At what point? When did you take these? When did you not take these? So you can imagine how it can get a little bit weird. Okay, gaining access form. You're going to get a form or gaining access informational sheet that it was put together to help people navigate. It has numbers for the Senior Medicare Patrol Program, for the State Health Insurance Program, for the Medicare Advocacy Project, for the Attorney General's Office, Centers for Medicare and Medicaid Services. A wealth of information on that sheet that you really should feel free to share it with colleagues. It's being emailed to you, so please share. And it's really Massachusetts-based, and I apologize to all of you, but maybe your states can adopt something like it, other states. So here, I wanted just to remind people of this, because so often beneficiaries and family members don't know where to turn. So in the event that Medicare beneficiaries encounter a legal problem in relation to Medicare, not getting a service, not getting it paid for, and they're feeling like, I'm entitled to this. Not right. There's the Medicare Advocacy Project. So, and they help Medicare beneficiaries with free legal assistance on Medicare appeals and a lot of other things. So I would strongly suggest that we all get to know our MAP, our Medicare Advocacy Project. And in Boston, for those of you who are in the Massachusetts area, this is the number, and that's their website. Okay, steps to address healthcare errors, fraud, and abuse. Okay, well, call the SMP program, because if we can't help you, we'll guide you. We'll pull up that gaining access form, and we'll tell you who to call. It's a quick resource we've got. Okay, and also the SMP Resource Center. And you know what? I actually forgot, and I apologize, to put their number and website on there, and I will do that and resend this to you, Laurie, because the slides you've got are these slides, and I apologize. But I will tweak this when the webinar is over, and I'll send you a new deck of slides. The Executive Office of Elder Affairs. So the SMP, back up, SMP Resource Center is the National Resource Center, and that's the website you would go to, or the number that you would call to find out who do I contact in Florida? Who do I contact in Washington, D.C. or Guam or California or Alaska or anywhere, okay, in the United States or the U.S. territories I mentioned. So the Executive Office of Elder Affairs Shine program, tremendous resource, especially now with open enrollment. You know, people really should contact them in relation to Medicare and other health benefits eligibility that that supplements Medicare. So Medicare 1-800, that's a very good number to have in hand. The Inspector General's hotline for any tips, and then the Medicaid Front Unit at the Attorney General's office. So all of these numbers on that are on that gaining access form that I shared with you. So all Medicare and Medicaid beneficiaries, family members, caregivers, all healthcare consumers, back to all that will listen to us, okay, all need to understand the importance of being very present for their healthcare encounter, and always to look at their bills and their receipts and their explanation of benefits and their Medicare summary notices if they're on Medicare. We all should be getting explanation of benefits, and if you're not, you should be contacting your health insurance company and saying to them, you need to send this to me, I want it. And also, in regards to your bills, you can ask the hospital or your healthcare provider to send you an itemized bill. And that's going to become more and more popular, in particular, as we move towards transparency and really understanding what the cost of our healthcare is costing us. You know, what is the X-ray costing at Hospital A in comparison to Hospital B, C, or D? That's coming very quickly. If not receiving these documents, again, I encourage you to please inquire as to why not and ask for them. I want that document. Please send it to me. Some of us don't want more paper, and I totally get it, but it's important to see this. Okay, word of caution, and this is for all of us, but we always encourage our Medicare beneficiaries to not pay bills until they have compared their bills against the SMP Personal Health Care Journal, their Medicare summary notices, and their explanation of benefits, and other insurance statements. It's very important because it's a lot easier for the person to then compare things, call the providers, figure out why am I charged this, why is this happening this way, and then write the check as opposed to writing the check and then trying to get reimbursed. Quick reminder, Medicare will not call or visit or solicit, sell products, plans, or give anything away. So if somebody calls you and they're telling you they're calling you from Medicare, I would strongly suggest to say, you know, thank you very much, but I'm not interested. And if something does not feel or sound right in your gut, it's probably not. You know, we all get those calls from some telemarketer, you know, that we've won the trip of a lifetime and we've heard the cruise ship horn go off. You want a cruise, give me this, you need to buy this immediately, give me your credit card number. You know, it just doesn't feel right. And I say to people, you know, if your ship hasn't come in, it's probably not going to unless you really work for it. So if something doesn't feel right again or sound right, call the SMP program. This is our number. Visit the SMP program on our website, masssmp.org or medicareoutreach.org, which I should have put on there. It's on the front sheet and the back sheet. And for SMP programs that are in other states, please feel free to go to the smpresource.org. That's the National Resource Center. And I hope that this is going to work for you, but it is everyone's responsibility. So just be aware that we all hold the key to preventing healthcare errors, fraud, and abuse by becoming fully engaged in our healthcare, being very present for those encounters, and encouraging our friends and our loved ones to do the same. And I'm going to try to play this. This is and I don't know if you're going to be able to hear it or not, but I will soon find out from you. This is something that aired on National Public Radio. So, any questions? And then I just want to thank you all for participating today. Thank you much.
Thank you very much, Lucilia. Okay, so if you, are you playing your audio?
I am. I'm going to put it right up.
Well, we don't hear anything yet.
Oh, you should be.
No, unfortunately, I don't hear anything.
Oh. I have, did I mute something?
If you'd like, you can provide a link to me and I can send it out if people want it. I can send it to them and they
can that would be,
okay.
I think that, I will also just tell you how to get it on, how to get this on YouTube. So just quickly, I'll give you like 2 minutes of this story. This is my father. And this is Antonio's story, is my father's story, which I wrote and I produced a video in collaboration with the BU School of Public Health and Healthcare for All. And my father died as a result of a hospital-acquired infection and a serious reportable event. And I just want to leave you with this. 270 people, approximately 100,000 people die annually in the United States as a result of a hospital-acquired infection. And approximately another 100,000 people in the United States die as a result of serious reportable events. And so that's the equivalent of 2 plane crashes daily. And each plane crash, 270 people, 273 people to be exact, in each one of those planes perishing. So imagine we have one on the East Coast and one on the West Coast daily, 2 plane crashes, and all 540 some odd passengers perishing. What would the FAA do? What would our government do? What would the public reaction be? So we need to be very engaged and really understand what's going on. So I leave you with that. I'll send you the link to the video. I'm sorry the video didn't work out, but this is one way that I committed to my father that I would continue to do this work and to help others. And it's been very cathartic, and it's a way to keep him alive. So thank you all.
Thank you so much, Lucilia, and thank you for sharing your very personal story with us. I'm deeply sorry for your loss. I admire you for what you're doing, and I think you're fighting a really good fight. And all the tips you gave us today are practical and things that we should all keep in mind, regardless of what type of insurance we have, be it through the state, the Fed, or a private insurance carrier. One question is, where can one obtain an SMP personal health care journal? How can they get one of those?
If you call us, we will mail you one, or email, we will send you one, as long as you provide us with name, address, location, and the number you need, the number of journals. If that question is coming from somebody out of state, then you should contact your state's SMP.
Okay. Another question is, yes, most definitely you can certainly have a copy of Lucilia's PowerPoint presentation. If you would like a copy, I'm going to put up my contact information right now. In a moment you'll see this. So if you would like a copy of Lucilia's presentation or the documents that she referenced, also the link to the video, please email Lori@NeedyMeds.org, and I'd be happy to send that out to you. On the other hand, if you have a question about finding assistance for your healthcare costs, Please do not email me. We have a team of helpline operators standing by to help you with that. And you can reach them on our toll-free number, which is 800-503-6897, Monday through Friday, 9 to 5 Eastern Time. Any other questions can be directed to me, though. We're winding down. Are there any other questions at this time? Another moment or two just to type them in. Okay. Well, thank you very much for joining us today.